students, welcome back. Now we are going to see the mediastinal surfaces of the lungs. In that, the first one is the right lung. Some of the structures are related to the mediastinal surfaces of the right lung and the left lung. So as we know that, these lungs are present like this, isn't it? Okay, this is left lung and this one is right lung. So this is the root of the lung, and so if you want to see the mediastinal surface, that means space present in between the two lungs, is called the mediastinal surface, mediastinium space. So the side which is facing to this space is called as mediastinal surfaces, or medial surface we can call it as. So if you want to see this, so I am rotating this lung. I am rotating this lung in this way. So I make this lung to rotate like this to expose this medial surface. Okay, so for that, what is happening, this anterior border will come this side and the posterior aspect of the lung comes on this side. Okay, so this is about the mediastinal surface of the right lung. Now we are going to see what are the structures related to the right lung. Okay, at this center you'll have this part. So this is called as a root of the lung. So in the root of the lung, and this elongated part, this one is the pulmonary ligament. This one I have already explained. So through this root of the lung, some structures are passing in and some structures are passing out, and this root of lung we are going to see separately. So now, what are the structures related to the right side of the lung? So I have already mentioned that the mediastinal surface is divided into two parts. One is the mediastinal part anteriorly, and this one is the vertebral part. Okay, now we are going to see what are the structures which are related on the mediastinal surface of the right lung. Now first we are going to see from anterior to the posterior side, or anyway, first we are going to see this thing. So anteriorly, this first one is the on the upper part. We can see the lower part of the right brachiocephalic vein. This is the lower part of right brachiocephalic vein. So here we can see very clearly. Yes, this is the brachiocephalic vein, and then the part here you can see at the lower end will have the inferior vena cava. What is that? Inferior vena cava. And this part is superior vena cava. This one is superior vena cava, and above this one is the right brachiocephalic vein. So this right brachiocephalic vein finally terminated into the superior vena cava, and this one is the inferior vena cava. Okay, this is present on the anterior aspect. Okay, and this is the part of the right lung. So this part, so I have told that this is superior vena cava and inferior vena cava. Come on, tell me. So normally these two will end up in which part of the lung? So it end up into the right atrium. So this surface is related to the right atrium. Okay, now on the mediastinal aspect, in the mediastinal aspect, on the anterior aspect you have seen that. So brachiocephalic vein, superior vena cava, inferior vena cava, and these two end up in the right atrium. Okay, and then what is happening? So this above part here, you will have some relation to ascending aorta. So it is related some part, only some part, very slightly it is related to the ascending aorta. So that means ascending aorta, which is coming from left ventricle, isn't it? So from the left ventricle here, this one is this part is related to the ascending aorta. Okay, and then so this is present on the anterior aspect, and it is also related to a small part of right ventricle also. It is also related to right ventricle also. So, and the next one is the Ajos vein. I have told that on the right side, this Ajos vein will arch over the root of the lung, and finally it terminates into the superior vena cava, isn't it? So it terminates into superior vena cava. So this Ajos vein is also related on the mediastinal surface of the right lung. Okay, now coming to the nerves, two nerves are related here. One is the phrenic nerve. So this one is the phrenic nerve. So this phrenic nerve is coming here over this superior vena cava and towards the inferior vena cava. So here this phrenic nerve is passing on the mediastinal aspect, and then so behind this you'll have another nerve called right vagus nerve is related. Right vagus nerve is related, and then by the side of this right vagus nerve, it is related to the right side of the trachea. So this surface is related to the trachea. Here you can see some. So this is the trachea. You can see this is the trachea. So above the root you'll have, so it is the trachea is ending up at the level of T4 vertebra. So it is related to this much area only. And behind this trachea you will have this esophagus. So these are all the structures related to the mediastinal surface of the right lung. Again we will see. Yes. So anteriorly it is related to the brachiocephalic vein. So this end up into the superior vena cava, and on the same side inferiorly it is related to inferior vena cava, and these two end up actually into right atrium and auricle. This one is related at this area, right atrium and right auricle, and then ascending aorta is related to this and the most anterior part of this mediastinum, and afterwards two nerves are related. This one is the phrenic nerve, and this one above the this root of the lung you'll have this right vagus nerve, and by the side of it is related to the trachea, right side of the trachea, and then more posteriorly it is related to the esophagus. So these are the structures related to the right lung. So now if you see this hilum, we can call it as hilum or a root of the lung. So this is hilum or a root of the lung, and this one is extended downwards. So this part is called as pulmonary ligament. I have already told that this pulmonary ligament is filled with some areola or tissue, and these structures helps in the expansion of all these vessels during exercises, and it gives some space to expand all these vessels. And this hilum will have this is the way from which some structures are passing out of the lung and some structures are passing to the lung. So this is the space it has to so it is called as root of lung. So through this root of lung only some of the structures which are coming outside can enter into the lung, and some structures from the lung to the outside are coming out through this root of the lung. So normally the root of the lung is short, broad pedicle. So this one is the pedicle, broad pedicle, which connects the medial side or the medial surface of the lung to the mediastinum. It is formed by structures which either enter or come out of the hilum, come out of the lung at the hilum. So these roots of the lungs on both the sides lie opposite to the bodies of 5th, 6th and 7th thoracic vertebra. In the left lung also the root is present at this level only, at T5, T6, T7 vertebrae level. Okay, and this root consists of some of the structures. So the structures are, here we can see this bronchus, that one is the hypatrial bronchus. So this one is hypatrial and epiarterial bronchus. This one is epiarterial bronchi, and this one is hypaarterial bronchi. Epiarterial means above and this one is below. And it is having one pulmonary artery and two pulmonary veins. These are the structures present here. So normally, so this is present at the topmost, epiarterial bronchus, pulmonary artery, hypaarterial bronchus and inferior pulmonary vein. Anteriorly, superior pulmonary vein is present. So, and inside this some of the areolar tissues are present in the pulmonary ligament. So some of the lymphatics are also related to this area, like bronchopulmonary lymph nodes. This is all about the structures which are related to the mediastinal surface of the right lung. In the next video we are going to see the left lung mediastinal structures related to that surface. Thank you.